Welcome back to movementprofessional.com. So today I want to go through a little bit of self-treatment on my own shoulder. A couple of weeks back I was doing some Turkish get-ups with a little heavier weight and felt fine while I was doing it afterwards. Had a little bit of a tweak in the shoulder. So when I've been going through some of my own self-treatment, I figured I would put that on camera a little bit to just show my process, and if someone's dealing with the same thing, just to kind of see how you can make change pretty quickly and how you want to use your symptoms as an assessment tool. All right, so from what I've been testing so far, I know that my comparable signs or my symptoms come on with bringing the arm up to the side. Right now it feels pretty clear, but right around this mid-range here, I get some pain right on the top, and it feels like I just can't really get my arm close to the ear without some shrugging going on with the shoulder, some tightness on the side there. This side feels a lot freer. All right. The other piece is when I was bringing my elbows back this way and then rotating into this external rotation, feel a little bit of a pinching through there. All right. So there's some baselines. As I was doing a little bit more exploration on my stomach, this is really where I found a lot of the symptoms. So I was coming down here, arms overhead, left shoulder, feel the symptom and more restricted. When I try to lift this left arm, can barely do it and it's painful. Right arm, much easier to come up. And then I want to play with different angles. Easier there, easier, pretty clear through. Now I found down here, as I lift, start with my palms up and then turn down, and then I engage my core by doing a little bit of a posterior pelvic tilt. It just feels a lot harder on the left than the right. Feel my tricep and my lat activating much more, almost going into a spasm on the left. Much easier on the right. All right, so there's an asymmetry there. All right, and then the biggest asymmetry I think I found was moving into this child's pose and then having my arms overhead. Left side just feels very, very tight through the lateral shoulder blade here. So, some symptoms was worse before. Done a little work on it, it's a little bit better. All right, right arm comes up, left arm can't move. Try to move it, and I get that symptom kind of on the top of the shoulder. All right. So first thing I want to look at is this big hunk of lat on the outside. See if we can make some change to that, see if that frees up some of that motion. All right, so you can use a foam roller. I like using the Supernova to get right into here. It's just a nice firm ball. All right, and I'm going to just try to get right on the outside, find where it's tender, but I also want to be making this as active as possible. So the movement I'm having difficulty with is overhead, and then also trying to get my arm kind of close to the ear without shrugging. So I want to be very specific to the movement that I'm limited with. All right, so I find the restriction, it's tender where the ball is, and then I move up. I could breathe out and activate. I'm going to do 10 here. And I'm not just making it about the arm, I'm thinking about what's going on in the center here too. So I have my right leg straight, I can actually reach my right leg long, so I create a sense of tension in my belly. Can keep my knees bent too, and then just do like a little bit of a rib cage drop or a pelvic tilt as I lift overhead, so I don't turn it into something where I'm arching my back, all right, and I'm really getting right at the shoulder here, so there's no compensation. And I can explore for a little bit longer, see if there's anything else going on down there. All right, I want to get a little bit lower, like at the bottom part of the shoulder blade. Yep, that feels tender in there, and restricted when I try to lift through there. All right, so now I'm going to retest. We'll see if that's any better, just to give me some information. All right, so sit back. Raise the right arm. No pain. Still pretty limited there. Okay, so the other thing I could start thinking of is what has to happen starting centrally. If I think, core, thoracic spine, what has to happen for me to go overhead? Not just the shoulder. I have to be able to do a little bit of thoracic extension and rotation, going to the left to get my arm overhead. So, all right, so I'm going to grab a tune-up ball, or a pinky ball, and I can go on the inside of the shoulder, but between the spine and my left shoulder blade. So that's going to be approximately the area of the thoracic vertebrae. And then also you got some muscles in there like your rhomboids, middle trap runs through there. So we just find the most tender spot. So the trigger points are one piece of it, and the other piece is just actually go through the movement that I'm limited with. Again, as I'm overhead, it's the most overhead position that's really limited, and I just can't go any further. All right, so I'm just going to bridge up and down, trying to find the most restricted spot. When I say restricted, I mean when I drop my body down, what feels like it just doesn't want to give. It doesn't want to let the ball in. All right, I want to stay on that most restricted spot because that's going to be most likely what's stopping my arm, or at least a piece of what's stopping my arm from getting overhead. All right, so right there, I feel the most resistance. I want to stay stable through the midline so I'm not compensating and just moving my butt up and down by arching the back, but I stay tilted so the pressure is just in the area of the thoracic spine. All right, I can use my other hand to really pull the arm closer to the ear. And then I also wanted to try to do a little contract relax where I move my left hand into the mat and release. Left hand into the mat, release. Now I'm in child's pose. My knees are going to be up into a hip flexion, so my thighs almost near my belly. All right, so I can add a little bit of that. So I'm doing like a one-legged bridge. Pull this in. Try to make it as close to the movement I'm restricted with as possible. All right, I'm going to retest. Sit back. Getting there. No pain, but still quite a bit of difference. All right, so now I want to do a little bit of work actually just on trying to get some rotation through the thoracic spine. So I'm going to get into this lumbar lock position. I'm going to put my right elbow on my right knee, left hand behind the back. All right, I want to push my right elbow down, breathe and twist. Just want to see how tight that is. Use my exhale, push my right arm down, try to get a little bit more motion with each rep, pull my shoulder back. I'm going to do 5 here. All right, retest. Getting up there a little bit. No pain, that's important. Definitely still different than the other side. Then if I go flat, pretty easy to lift now without that addition of hip and trunk flexion. All right, and I can also do hand behind head here, which buys a little bit more external rotation. Excuse me, as I go into this thoracic rotation on this side. Push the right elbow down, pull the belly in, breathe all the air out. Getting a little bit better. Much freer there, no pain. All right, so I still got some work to do, but now I've already made change, and now I'm not having any symptoms, at least on my stomach and prone. Still have some difference side to side when I'm in that child's pose. I'm going to check in standing. Much easier here. There was resistance to get my arm touching my ear. Completely free now. Pain-free, completely free going through that. All right, so that's just using the symptom as assessment. Not perfect yet. I'm going to have to keep maintaining that. I fully expect that tightness to come back. So I just got to keep doing my exercises to manage it. If you have any questions, you go to movementprofessional.com. I'll see you next time.